How's it going, guys? So we have a pass level easy diagnosis here in combination with some challenging Pharm application. Okay, I decided to give you guys additional value because I know for some of you this will be too easy of a question otherwise. So before we get started, please subscribe to my channel. I really appreciate it. Give the video a like, really appreciate it. Find me on Instagram at Mehlman_medical, MEHLMAN_medical. Link is down below. Find me on Telegram. Recently created a Telegram group and channel. Links are down below. Now let's start the question here. 27-year-old woman, 2-month history of thin gray vaginal discharge. Her last menstrual period was 2 weeks ago. Obviously, this means she's not pregnant. And then we have this spot image here of clue cells, which is bacterial vaginosis caused by an organism, Gardnerella vaginalis. So these are showing squamous epithelial cells studded with, covered in bacteria. They look very grainy. Those are supposed to be the bacteria covering the epithelial cells, clue cells. So you can diagnose with not just the wet mount here showing the clue cells, but also you can do a whiff test where you add 10% potassium hydroxide to the vaginal discharge, and it can produce a fish-like odor. Okay, thin gray vaginal discharge, very buzzy. They can also say for chlamydia, gonorrhea, they'll say a mucopurulent discharge. For candida, thick white cottage cheese discharge. For trichomonas vaginalis, they'll say a yellow-green discharge. We're talking textbook type of descriptors here. There is variation, okay? You have to be able to lateralize and keep yourself open a bit for questions, but those are the stereotypical descriptions. Now let's move on to the question. We say, well, how do we treat it? We're going to treat with metronidazole, okay? I mean, that's the standard treatment. It's topical metronidazole. It causes the formation of toxic metabolites that damage DNA. That's the step one mechanism of action. And we say, well, what else would we use metronidazole for? Let's just go backwards here. So pulmonary abscess, wrong fucking answer. We use clindamycin to treat pulmonary abscess. Very high yield for step 1 and 2, okay? Clindamycin, pulmonary abscess. Now, some students will get pedantic, and as I talked about in the last clip, you can technically use topical clindamycin for bacterial vaginosis. You can. The same way you could technically use 6 or 7 different antibiotics for many diagnoses. But the classic is metronidazole. Okay, so that's how we treat. And pulmonary abscess is clindamycin. Wrong fucking answer. Pseudomembranous colitis, also wrong answer. This is C. difficile. This is going to be oral vancomycin as of February 2018. It used to be oral metronidazole, not anymore, okay? Oral vancomycin, very high yield that you know that treatment for pseudomembranous colitis. Lyme disease, wrong answer. This is a lengthy discussion. Doxycyclines are classic treatment. Do not give doxycycline to pregnant women or children 8 or younger for Lyme disease. You would give amoxicillin or ceftriaxone to those patients. Gonorrhea, wrong fucking answer. This is going to be ceftriaxone. This is how we treat. Okay, if patient has gonorrhea, we'd also co-treat. So you give ceftriaxone for the gonorrhea, plus azithromycin or doxy for chlamydia. And that's how you're always going to treat gonorrhea. It's always going to be co-treatment, even though the ceftriaxone is technically what's treating the gonococcus. Diverticulitis is the correct answer. Okay, so diverticulitis. Metronidazole is used for anaerobes below the diaphragm. Now, we tend to combine metronidazole with a fluoroquinolone, such as ciprofloxacin. Okay, metronidazole can also be combined with augmentin, so amoxicillin sulbactam. Now, or amoxicillin clavulanate. You can use ampicillin sulbactam IV, but it tends to be oral amoxicillin clavulanate plus metronidazole for diverticulitis. Now, even if you're not like an attending, which you're not when you're reading this fucking question here, and you say, well, am I supposed to know the nitpicky detail about diverticulitis specifically being treated with metronidazole? I'll tell you what you need to know. This is what USMLE will do. These other 4 answer choices are super fucking high yield as far as how you treat them. And you definitely don't use metronidazole to treat them. So you can kind of go to diverticulitis and say, well, this one's the odd one out. And metronidazole is used for anaerobes below the diaphragm. Clindamycin is anaerobes above the diaphragm. So if you know that combination, metronidazole anaerobes below the diaphragm, plus these other 4 are definitely wrong, we're left with diverticulitis here, okay? Metronidazole plus a fluoroquinolone or metronidazole plus augmentin is how we treat diverticulitis. Clue cells, spot diagnosis, pass level for USMLE, Gardnerella vaginalis. You know the deal. I'm going to continue making more content. If you like my stuff, subscribe to my channel. And I appreciate your time. That's it.